Each citizen in the Netherlands should have a general practitioner to provide personalized health care. Better continuity of care between patient and GP is related with less mortality and less unplanned visits to the hospital. However, continuity of care is under pressure due to rising healthcare demands and a lack of professionals in primary care. In our department, we look for ways to turn this for the better. In my research, I investigate how interprofessional collaboration and primary-secondary care collaboration could be designed to create more coherence in the way patients experience their care. I want to create opportunities for students and GP trainees to learn interprofessionally with other students. This way we educate doctors for the future of healthcare who know how to collaborate well. In my department, we have a lot of data from general practices in our network. This is a goldmine for research, not only for general practice, but also for our partners in collaboration. My name is Nynke Scherpbier and I am a general practitioner.